mtoto amelia pale kwa kiti na the mother ako hapa kwa simu. Ako tu ana scroll TikTok. Na mtoto analia and the mother is not bothered. That is a possible sign of postpartum depression. Because that carelessness towards taking care of the child is not normal. No, it's not normal. Most people think that giving birth is 100% joyous moment or a joyous experience for every woman. But it's not. You are going to gather facts that it is not a joyous moment for every woman by the fact that some of them will actually do abortion before they get to giving birth. You see? So then that means if there are some who are aborting before they get to delivery, that means that there are some who are getting into delivery wishing they had done the abortions. Because of factors that we are going to talk about. When we talk about postpartum depression, it is what not just a mother, but the parents. Because sometimes again, when we talk about postpartum depression, the only picture that comes in mind to most people is the mother of the child. But the father also goes through postpartum depression. So postpartum depression is...
Kwa hivyo unamaanisha mwalimu ni kwamba ugonjwa huu pia unashika hata na wanaume.
Yeah, unashika wanaume.
Okay.
Yes. Because the man is also has some changes to undergo in his life. Wakati kuna mtoto ambaye amekuja katika familia. So then postpartum depression is some of the challenges, that psychological challenges that somebody encounters after giving birth. You've mentioned the word baby blues. So baby blues is a very common symptom to most mothers. But baby blues, the difference between baby blues and postpartum depression is that mostly the duration, how long these symptoms are going to show up. Because when you're talking about the baby blues usually show up as, this mother is very irritable, kukasirika ovyo, So kulia, episodes of crying, unapata tu amekaa peke yake amelia, huwezi jua kama ni machozi ya furaha ama ni machozi ya, but this mother is crying. That is a sign of baby blues. Also issues to do with eating and sleeping. We have irregularities. When it comes to eating, unapata hana appetite. Mwingine imejaa, appetite inasoma 100%. So kuna mwenye anakula sana, kuna mwenye hadi kabisa. Then we also have issues of sleeping. Well, it is very common wakati mtoto amezaliwa nayo kulala as parents. Sasa hiyo inakuwa ni
sababu kuna wale watoto ambao wanalia usiku.
Yes, the whole night. Sasa mchana wakati sasa wewe ndio unataka ufue nguo na uoshe vyombo ndio kanalala sasa. Lakini sasa wewe wakati wewe unataka kulala sasa ndio kapo huko kanalia kanasumbua and all that. So that also it is not something that somebody can enjoy, but it also has its own effects. So those are some of the signs of baby blues, which are similar to the signs of postpartum depression, especially at the early stages, and especially with withdrawal. You've given a very significant and common example that pale ulikuwa unapita mtaani ulisikia wamama fulani wakiambia mama mwingine huyo ni kapendi mtoto amezaliwa the other day but ni kama hapendi mtoto, So huyo mama, you might realize that she is actually either experiencing baby blues or she is actually in the early stages of postpartum depression. Because when a mother is under postpartum depression or is experiencing postpartum depression signs, unapata hata hana ile motivation na ile unajua kuna ile enthusiasm mzazi anakuwa nayo ya ku take care of the baby. And mtoto akilia amemnyonyesha, mtoto akilia amemchukua, amemwangalia kama ni diaper anafaa kuchangewa. Then you find a mother, mtoto amelia pale hata amwangalie. Yes, amwangalie. That mother is not bothered by the child's cries and all that. So mtoto hata alia aje yeye hashughuliki yako. That's not normal. That's not normal. So that is someone who is experiencing something. So baby blues usually last within the first 2 weeks after giving birth. After delivery, the first 2 weeks, ndio hiyo tunasema hiyo ni baby blues. Common. There are going to be hormonal changes because again mwili yako umeanza kunyonyesha na huko umezoea kunyonyesha. So hii mwili sasa imechanganyikiwa. Ni nini hizi zinavurutwa huko, So haiko imezoea kutoa maziwa. Yes, it had started manufacturing the milk, but hiyo kunyonywa na hiyo sensation ya mtoto kunyonya and all that, then again it's challenging. Remember, mwili yako pia your imechokorwa kidogo. There's the afterbirth imetolewa. Mwili yako maybe during birth there was some complication here and there. So definitely there must be changes. Especially hormonal changes. So hormonal changes usually interfere with somebody's emotions. That's why you find a mother is very moody. Ndio huyo sahi amefurahia mumecheka, the next minute amekasirika. You know, watu wengine wanasema huyu mama amekuwa kisirani. But it's because of the emotional changes that are happening. So those are some of the signs of baby blues, but also common signs of postpartum depression. But what I've said is, the difference between baby blues is this and depression is that baby blues usually last around 2 weeks. Ikienda sana ni mid 2 weeks, maximum 3 weeks. But by 2 weeks inafaa ikuwe imeisha baby blues. Then after that, if this mother continues to have these episodes, this mother is, you know, we'll talk about the signs, is continuing with the signs of baby blues, then that's not baby blues anymore. That now we need to call it something else, which is now diagnosed as postpartum depression. Yes. The preference of postpartum depression is 25 to 30% of women who have given birth.
Hiyo ni ile sasa imekithiri.
Yes.
Ile iko kwa ile hali kubwa.
And that's a very high number. That's a very high number, especially now when it comes to an issue which nobody is really talking about.
True.
So 25 women in 100 women who have given birth.
Hiyo ni kama robo.
Yes, robo, a quarter. They have been diagnosed with postpartum depression. Those are the ones who have been diagnosed. There are very many others who have not been diagnosed. That translates
kuna wale pia labda waende hospitali ama pia wanapuuza tu.
Anapuuza tu, anasema maybe this is normal, hii itaisha. You know, and then that translates to 10 women, that in 10 women who have given birth, 3 of them have postpartum depression. You see? So in 4 then, 1 most likely has postpartum depression, if you narrow down those statistics. So that preference is not something that we should be taking lightly. And it's actually taken lightly because most people think that giving birth is 100% joyous moment or a joyous experience for every woman. But it's not. You are going to gather facts that it is not a joyous moment for every woman by the fact that some of them will actually do abortion before they get to giving birth. You see? So then that means if there are some who are aborting before they get to delivery, that means that there are some who are getting into delivery wishing they had done the abortions. Because of factors that we are going to talk about. So the preference of postpartum depression is very high. And it is commonly mistaken with hii ni normal, itaisha tu, usijali, mtu analiaga tu, ni machozi ya furaha. You know, come on. Mbona unalia machozi ya furaha mwezi mzima? Mbona unalia machozi ya furaha for 3 months? You see? And most people wanaambiwa tu, hiyo itaisha. Just give it time, itaisha tu. No. Much of these emotional and psychological things haziishagi tu. Because hazikukuja tu. Yes, hazikuja tu. So hakuna venye zitaisha tu. I always tell people that postpartum depression, much of its risk factors usually show up prepartum. Before giving birth, you can actually tell there are higher chances of this mother developing postpartum depression. Because number one, you find a mother who is very anxious about giving birth. There's a mother who is worried that, you know, what if when I'll be giving birth, I'm going to develop fistula? You know, what if while giving birth, I'm going to die or the baby is going to die? Will I be able to push the baby? Will the baby be healthy? Will everything be okay? So that anxiety alone usually puts this mother at a very risky position, psychologically and even emotionally, to develop postpartum depression. So we have various risk factors, and something that I always say is this: pregnancy journey is not a joke. Women know that. And any man who has been close to a woman who has been pregnant once, twice, 3 times, they know that. These people usually go through a lot of pain most of the times. They go through a lot of struggling, you know, because it's not easy for you, even as a man, to carry about 2 to 5 kilograms of something on your belly. Wekere tu hapa ufugirie hapa kitu umebeba for several months, because when they get to the third trimester, it's called the third trimester, yes. So at that particular time, the baby is several kgs, maybe 1, 2. Also, you calculate the fluids and the afterbirth and all that. So it's not easy. And as Bazu, you've mentioned,
yes,
if there's something that every lady who is pregnant out there needs more than anything else, it is support from someone. I'm going to tell you for free, and this is a fact.
Yes.
Personally, every time that my wife is pregnant, especially the last month, I always sacrifice to do everything in the house. You'll find me washing clothes. You'll find me washing utensils. You'll find me sometimes suguaring mgongo hapa inauma nini. So because I'm the one who is there, and I cannot, siwezi mwambia nao umebeba sana huyu mtoto, the pregnancy, so toa kidogo na mimi nikusaidia kubeba wiki mbili. No, it can't happen. But you see, you can try to make the life of this person a little bit easier to carry the pregnancy. Because you cannot help carry the pregnancy, then you can try to make the things easier within the environment to make sure that the journey is a little bit, simpler and more, not as challenging as there's nobody there. So, number one, when you're talking about risk factors, it's financial factors. There's nothing as challenging for most women giving birth as financial crisis. Anaangalia tu hivi akiingia kwa bedroom, anapata sijanunua nguo kadhaa za mtoto. Sina pesa ya hospitali.
Kweli.
In case niende niambiwe emergency ya CS, sina hiyo pesa, After that, I will not be able to work or do anything for several months. That means I will need finances. I will need someone, nahitaji uji, nahitaji soup, nahitaji nikule fruits, nahitaji nikule nutritious food, and I don't have the money. So financial factor usually plays a very major role when it comes to postpartum depression. Unakumbuka mtoto atakuwa akivalia diaper every single day, several of them. And then sasa ukikumbuka ile pesa uko nayo kidogo, maybe ni rent and all that, there's nobody else to support you, then it becomes a major challenge. Number 2, we have social factors. Social factors usually translate to the associations, the relations that this mother has with the closest people to her. So if for example, this mother ako kwa ile situation ya jamaa aliruka miba, wacha nitumie hiyo lugha. Jamaa aliruka miba kama chura. Aliambiwa we are what? I don't know you. We whose? Wewe bwana ukatafuta baba wake. Mimi hata sijai kukuona. Hapana, tumekuwa wewe umenifananisha na mtu mwingine. A lady who is going through that kind of an experience is definitely going to, most likely, that's a risk factor. They are going to develop postpartum depression. Because I've given birth. I don't have the money, probably, ya kuajiri a house help, hakuja nisaidie. It's me and me alone. Maybe even family members. Na ikuwe it's worse, maybe it was a student. Maybe alikuwa shule, college, wapi, and then akaenda kuambia mamake, wewe, hebu enda huko, enda kwa yule mwenye alikupachika hiyo mimba. Hao ni wazazi. Enda tutakuona. Unajua mimi kwanza ni pastor, enda sitaki aibu kwa hiki kijiji, enda kwa yule mwenye alikupachika hiyo mimba. Ukifika kwa mwenye alikupachika hiyo mimba, ndio huyo chura ameruka. Now you are left alone. You see? So you are left in a position where you cannot be able to take care of yourself financially, emotionally, and all other kind of supports that you need. So that's another risk factor. The other risk factor is the issues that most of the times usually develop. The issue that I've mentioned of anxiety. You are very anxious.
Wasiwasi.
Yes, wasiwasi mingi, uoga mingi. That is going to put you in a position where now your mind is most likely going to welcome postpartum depression. Yeah? So we have women, and allow me to use the word women, although they don't like it very much, but let me use the word women. We have ladies who get pregnant and they have very high expectations, ambitions. Mimi nataka mtoto wangu azaliwe kwa private hospital, private wing, I want this. Nataka mtoto wangu akizaliwa akuwe already akona inaitwa trora ama inaitwa ajili ya kusukuma kwa mtoto. Yes, that one. Nataka aikue akona sijui kitanda yake already imetengenezwa hapa.
Baby cot.
Yes, baby cot. Nataka aikue already akona ka bedroom yake, sijui nini, fridge ikue imejaa, diaper roll mzima and all that. You see? So there are ladies who have so very high expectations towards how they are going to bring up this child. So yani amemgoja hivi, anataka huyu mtoto akae maisha ya juu. Ile maisha. And I always tell them that si ati unataka mtoto akae maisha ya juu, because the problem is not with the child.
True.
Well, shida iko kwako kwa sababu huyu mtoto hata umbebe na wheelbarrow, ama umvurute hivi na gunia kwa mchanga, ama umbebe na mgongo, ama umbebe na gari.
Bado atakuwa.
Huyu mtoto hajui. This child is not going to enjoy that.
True.
So you are doing all this not because you really want to take care of this child and do the luxury, but because there is something in you that is trying to overcompensate maybe something that you missed as a growing up. So maybe unasema growing up sisi suruali ilikuwa moja. Socks ilikuwa moja. Tulikuwa tunalala kwa kitanda moja tukiwa 17 na bozi ndizo zimetuzingira hivi. Ushago. Tulikuwa tunalala kwa floor. Tulikuwa, so I don't want to bring my child up like that. So that alone, that idea, yes, that idea alone, that I don't want to bring my child up the way I was brought up. Nataka mtoto wangu akuwe na nguo mingi za kuchange, nataka mtoto wangu akuwe anakula Indomie, akuwe anakula hizi kile zenye wanakula watoto inachanganywa na maziwa inaitwa nini? Weetabix. Akula anakula Weetabix, fruits every day, nini. So that luxury alone is a risk factor if you are obsessed about it.
True.
And you forget that the only thing that this child want is a place to thrive.
Yeah.
Wewe pata tu ka blanket, hata kama atakuja kujifunika na blanket yako, hata kuwa mgonjwa.
Imetosha.
Hata kama atakuja socks yako ndio itabidi ukate hapa juu akuwe anavalia. Huyu mtoto bado atakuwa. So now when you open up your mind to room for stress, anxiety, and fear, then you have created a capacity for you to very quickly develop postpartum depression. So those are some of the common factors that I would say. We have financial factors, we have social factors, economic factors are now the financial ones. So we also have these high ambitions and anxiety that usually develop, wanting to create a one in a lifetime childbirth. Unataka upostiwe pale TikTok na YouTube everywhere, as the mother of the year, the child of the year, So yes, you are going to be, yes, utaenea. People are going to talk about you. People are going to sing you. How venye ulienda hospitali na limousine, venye ulifanya sijui nini. Fine. But after a few months, you're going to develop postpartum depression because wengine amekopa pesa. I've seen that. I've seen somebody go to a bank, anakopa 100,000. Anaenda ananunua nguo mpya za mtoto. It's like 40-50,000. Anaenda sijui ana mtoto sijui the mother anataka apelekwe sijui private wing. Sijui afanywe nini. By the end of the day, hata upelekwe private wing. Kama alikuwa azaliwe kijana hata azaliwe kuwa msichana.
Hapana.
Hata umwendee hospitali na limousine ama aendewe na wheelbarrow. Kama mtoto alikuwa azaliwa akiwa underweight, hata azaliwa akiwa akiwa overweight ama akiwa nini, atazaliwa akiwa hiyo underweight. So it's not really going to affect the baby in any way. So don't do something and put yourself in a risk to even not only risk your own life, but also even risk the life of this child, because wakati umehip madeni so that you can have a magical one in a lifetime delivery,
kununua hata vyakula.
Yes, uko na madeni, uko na stress. So those are some of the major, and again that one usually comes in wakati watu wanataka kujifananisha. Best yangu niliona alifanya, TikTok nimeona watu wanafanya, YouTube, that idea of comparison. I want to outdo, I want to outdo venye nimekuwa the trending whatever of giving birth. Mimi hata sitaki kwenda hospitali, I want to do a water bath nyumbani. Utakufa kwa hiyo water bath. You see, simply because you want publicity. So that opens room for postpartum depression.
Asante.
The signs. This is how you can know that you have postpartum depression, or how you can know that someone close to you actually has postpartum depression. Number one, second guessing your ability to take care of the child. Kuna most mothers unasikia akisema sioni kama nimetosha boga kuchunga mtoto, kulea mtoto. I don't think I'm a good mother enough to take care of this child. That's a sign. Because that sign translates to worthlessness. Feeling like you are not worthy to take care of a child. Maybe sometimes based on past experiences, or maybe based on whatever circumstances, and sometimes it also translates to financial circumstances. When you weigh yourself and then unaona ile pesa niko nayo sidhani kama itaweza ku take care of this child, so you feel like you're not worthy. You know? So number 3, we have frequent or regular crying. And that's why I said sometimes unasikia these ladies wakiambiwa usijali hiyo itaisha, ni machozi ya furaha. Seriously, there's no way you can be crying machozi ya furaha for months. Hii furaha nayo imeenda sana.
Kwani imekita.
Yes, every time you crying, you know. The fourth sign is irritability. Kakitu tu kadogo amelia.
No.
Is it irritable? Maybe for example as a husband, nilikuwa because maybe ni mimi na take care of my wife after giving birth. So namwambia ndio mimi napika ni sawa. Unaenda tu chumvi inapita tu kidogo.
Tiari.
That one is enough to kufanya alie. Hiyo amelia kila pahali it's for months. We said baby blues usually last for about 2 weeks. So now what we are talking about are persistent and recurrent signs after 2 weeks. So kakitu tu kadogo amelia. Mtoto amelia naye anaanza kulia. I've seen that, very common. You know, this baby is crying so much, amelia the whole night. You know, now the mother is also crying. So that frequent crying months after mtoto after the delivery now is also a possible sign of postpartum depression. So we don't want also to confuse it with the change of emotions that we talked about. But emotions, the hormonal imbalance or the hormonal changes do not really last that long. It's just for a period. So if this persists for weeks and months, then you need to go for a checkup. So number 4, we have the issue of irregular patterns of sleeping and also appetite issue. So there are ladies who have low appetite or high appetite. There's another one who is not able to sleep or is sleeping too much. I've even had cases of a mother having this issue with sleeping and oversleep, analalia mtoto mpaka mtoto anakufa. Anajisahau usiku, amezoea tu kuzunguka kwa kitanda, kufanya nini, anajisahau mtoto wako hapo, analalia mtoto. Unaamka asubuhi unapata mtoto haipo. So that also can be a sign of postpartum depression. So there's also another sign that I mentioned that like the example that you gave, that you find that it's a mother, but the kind of behavior this mother is portraying are not motherly behaviors.
Yes.
Mtoto amelia pale kwa kiti na the mother ako hapa kwa simu. Ako tu ana scroll TikTok. Na mtoto analia and the mother is not bothered. That is a possible sign of postpartum depression. Because that carelessness towards taking care of the child is not normal. No, it's not normal. Mama ako na amani wakati mtoto ako na amani, that's when the mother has peace. So you also find another mother who even forgets to breastfeed the child. Mwingine wakati anasikia maziwa imemchoma kwa breasts ndio anakumbuka. Mara ya mwisho alinyonya ni usiku wakati alikuwa analia na ni saa 8 ya usiku, ya mchana the next day. So ndio anakimbia kunyonyesha mtoto. And that's where you even find sometimes, not all the cases, but sometimes unapata mtoto amerudishwa hospitalini because akona hiyo inaitwa jaundice, mwingine the baby is not well hydrated because hanyonyi na obvious hakuna hali chakula, hanywi maji. So anakuwa dehydrated because hakunywi enough, hanyonyi enough. Yes. So that recklessness and carelessness is also a sign of postpartum depression. So we have withdrawing. That's another sign of postpartum depression.
Apendi sasa anataka tu akae kivyo.
Yes, ako tu kwa nyumba the whole day. The only time anapatikana ni wakati maybe either ameenda kwa duka ama ameenda ku sunbathe mtoto. I think it is called sunbathing. How hata hiyo jina sijui nimekumbuka aje. I really use it, but sunbathing the baby. So when that's only time unapata huyo mama wakati amesunbathe mtoto for a few minutes or 1 hour amerudi kwa nyumba. Any other time, even calls, mkimpigia hadi simu hashiki simu. Na si ati simu iko na shida ama yako na shida ya kusikia, no, but hashiki simu. Mkimuuliza yeye tukuje tukutembelea, na waambia no, I don't want anybody to come and visit me, nyinyi kaeni huko, sitaki mtu akuja kunitembelea. So those are some of the common issues when it comes, the common signs when it comes to postpartum depression.
Asante mwalimu, umetuelezea vizuri.
The fact is that postpartum depression is more of a psychological issue than it is of a medical issue, because it's psychologically created, or it manifests psychologically. So, because another sign that we may have forgotten, which is very vital, it's that even the mother fails to take care of themselves physically. Yes, unapata huyu mama hata kuoga haogi. Unapata ile vest ama t-shirt alikuwa nayo juzi ilikuwa imemwagikwa na maziwa huku, amekaa nayo wiki mzima. There is even smelling, vyombo haioshwi nini. So that untidiness, unkemptiness, even mtoto haoshwi na, so that is also another sign. So what I'm saying is, postpartum depression kupona nayo utapona. That's a fact. Hiyo sasa nayo, that wasn't is guaranteed. Unaweza pona 100%. Unless you kept quiet about the symptoms, you kept it to yourself for so long, such that it have matured into what I told you, postpartum psychosis. Postpartum psychosis is challenging to you can. Chances low, but you can. Mostly what is done is management. You manage through medication and behavioral change. Postpartum psychosis. But postpartum depression is 100% recoverable. You can recover that. So, you have asked the question, when is it the right time for you to seek help? Immediately, you realize something is odd. Immediately, you realize, these days I'm crying too much for no reason. Immediately, you start realizing, siku hizi nakaa siku 3 kama sijaoga. I have a problem with eating. Well, sleep pattern may be negotiated a little bit because of what I mentioned. Maybe mtoto the whole night analia. So that one we can negotiate a little bit. But those other common, the feeling of worthlessness, feeling like you are not worthy, feeling like you're not well equipped to take care of the baby. Sometimes even when it is worse, we have mothers who try to harm the baby. So unapata huyu mzazi amefikiria kuhamu huyo mtoto. Amefikiria ni nyonge haka, nikanyime maziwa akakufe, nimfunike na piro kwa kitanda akufe, na mimi mwenyewe nijiwe. Wengine wana attempt hadi kuchukua mtoto kwenda kutupa. So those are when it is extreme. So the moment you realize something is odd, something is normal, or the moment you have someone close to you, and then you realize this is not normal, this is not the person I know. Ujeri amejifungua, huyu si Njeri mwenye najua. Au ni Atieno ama ni Atieno ni msichana, sio? Yes, so no, this is not the same person that I knew. So there's something that is off. You need to take action immediately before it gets worse. Because the moment it gets to psychosis, it's a different story. From psychosis, you never know. It can even go all the way to schizophrenia. Schizophrenia ndio watu wanasema madawazimu. It can go to that. You see? So you need to make sure that before it gets worse, you've taken caution. There are 2 ways of treating postpartum depression. The common one and the most effective is psychotherapy. Psychotherapy is talk therapy. I'm a talk therapist. I'm a counselor. I'm a therapist. So you come to me, you tell me, Eliud, I've been experiencing this and that, and then now we start digging and knowing exactly where this is coming from. There's no medication that can eliminate fear. There's no medication that can eliminate anxiety. There's no medication that can help you to walk. There's no medication that can be used to treat feelings of worthlessness. That is talk therapy. That is now what I do. That's what we do as psychologists. So that is number 1. The other one is what we call pharmacotherapy. Pharmacotherapy is now the use of medication. Antipsychotic drugs, antidepressants, If it is psychosis, unapewa antipsychotic. If it is maybe it is just depression to lower your emotions and anxiety and all that. So you are given either stimulants or antidepressants. So you can use either two. Before we go to any other question that you might ask, please allow me to mention something about paternal postpartum depression.
Okay.
Because we have so much dwelt on maternal postpartum depression, paternal postpartum depression is a reality. Men go through postpartum depression. They never gave birth, but in psychologically they have given birth. Physically hakuna kakitu ametoa, lakini hapa this guy is being bothered. There is more responsibilities. Now the baby needs to be taken care of. If this is a caring husband, a caring guy, he is there every night when the baby is crying throughout the night. The wife is sleeping, and then the husband has to wake up also at night and asaidia mtoto pia. This guy, don't forget, he has to go to work in the morning. The busy day throughout the day. He is tired during the day, he comes back home, he has to help at night to take care of the baby. So this guy has some emotional changes that have happened. The environment is no longer the same. The same attention this guy was getting from the wife is now divided attention. And actually it's not divided by half. No, because the baby needs more attention than the husband. So kama alikuwa amezoea akifika nyumbani anashikwa, anatendekezwa hivi, anafanywa massage, anaitwa maneno mtamu, chakula ndio hiyo. Sasa akifika nyumbani after mtoto amekuja, yeye anakuja, anaweka vitu zake kando, anaenda kupika. Maji alikuwa anapata imechemshwa, ndio anakuja, anaenda kuchemsha maji, anaenda kuoga. Chakula ni anaenda kupika. At some point lazima asaidie pia the mother even to take care of the baby. So there's a lot of changes that has happened to a man when there's a new being in the family, and they also experience postpartum depression. Most ladies think huyu mwanaume ni ile tu ameanza kucheat. I've heard that very common. Just because nimejifungua sasa, siku hizi anakujaga usiku saa 5. Siku hizi na anajua niko na mtoto, anakujaga late. Lazima ako na mwanamke mwingine ameweka huko nje. Lazima ni I've even heard worse. Wako na maraya wengine, ni wale maraya wake huko nje. No. Don't judge a man that harshly saying that ni mwanamke mwingine ameweka huko nje because anakuja saa 5 ya usiku. Anakuja late than venye alikuwa amezoea after umejifungua wewe kama mama. Wacha kusema ni wale maraya wake huko, ni wale wasichana wake huko, sijui ni secretary wake ni nini. No. Before you judge a man that harshly, get first of all to understand that maybe this guy is trying to cope with postpartum depression. And the only way he knows how is going to party and drink with his friends after work. Anaenda anakunywa chupa bidi yake 3-4, anarudi nyumbani. Lazima atachelewa. So don't just be quick to say that you guy, you have changed. Siku hizi ni kama you no longer love me, you no longer take care of me, you're always coming home late, you are misusing the finances. Sit down with that guy. He is most likely suffering postpartum depression. Get first to understand him. Because yes, he never gave birth, but psychologically he has given birth. Because he has to take care of the new being as well. At some point as the mother, you need attention. You see? So unless now as a mother you are left alone, the single mothers. So those ones usually go through a lot, especially wakati mtoto ni mdogo. So if there's nobody to help you, just push through. You can do it. You can do it. Bazu, allow me to directly talk to a mother out there who is probably pregnant or just gave birth. Yes, of course. Carrying a pregnancy for 9 months is not easy. Nobody should lie to you. It's easy. People think actually it's very easy. They don't understand what is actually happening within you. There's a lot happening. But the fact that that child is growing within you means it is a fact and a reason enough to know that if you have carried for 1 month, you can carry for 9 months. If you have carried for 9 months, you can take care of for 10 years, for 20 years. So I want you to take easy on yourself. You're going through a lot of pain, of course. Pain that personally I can't write to you that I understand because I've not been pregnant. But listen to me. You can do this. There's no need to feel like you're not worthy taking care of that baby that you're carrying. You have all what it takes. Just imagine, the most important thing that baby really needs is your presence and your love. Just that. Believe me, the way they said that kanakuja na sahani yake yenyewe, kako nayo kwa tubo, kako nayo huko, kama relax tu nayo, katazaliwa nayo. Most kids usually bring blessings. Mtoto anakuja and then people are like, amejifungua, unapata umeletewa hii, ulikuwa na stress ya hii, you know. So don't stress yourself while you are pregnant, wondering how you're going to take care of the baby. You did not grow the hands of the baby. Huko ingia kwa nini kwa ati ukaigiza mkono kwa mdomo ndio uvurute mkono imee vidole ndio uvurute mapua ndio ufanye nini. No, that guy you're carrying has taken care of himself or herself. It had taken care of itself for 9 months. Believe me, everything is going to run on smoothly. All you need is to have that love, to know that everything is going to unfold to the positive direction. So carry the child. Don't be over ambitious. Don't stress yourself. Don't worry yourself. This child is going to grow. All you need is to be there. Take care of the child. And most importantly, if you have people who support you, please hold on to them. But if there's nobody supporting you, believe me, you are worthy. You have what it takes. You have the energy. You have the power. You have everything you need to take care of that baby. I always tell that. Hata ukijifungua na upate una pesa, wewe tuambie, you know.
Watu ni wakarimu.
Mtoto watarara ja. Seriously. Mtoto hawezi kula 1000. Just 100 bob, 200 bob. There are people of goodwill out there. So you're worth it. You have what it takes. But if you're in a position where you feel depressed, you feel stressed, you feel now, you know, the father disappeared from the picture, I am all by myself. Of course, you are not by yourself. I'm going to give you my number so that you can realize that you are not all by yourself. Just call me. We can talk, and then I can help you. There are so many people out there who are willing to support you. My contact is 0713 550 493. 0713 550 493. If you're feeling depressed, stressed as a mother, just call me. Let's talk.
Asante. Asante daktari Elliot kwa kuweza kuelezea na kuzungumzia huyo mama ambaye anapitia. Na najua ningependa muandike comments hapo chini ili tuweze kukagua na tuweze kuwajibu kwa ile njia ambayo inahitajika.